Our turn.
Instead of just seeing it on the screen, it gives you like what your next slide is. It gives you like notes, a place to put notes.
Yeah.
You guys have like on the wall.
No.
I didn't want people to be like. We just talked about poop. That was great.
Alright, hello everyone. My name is Anne Savannah. And we'll be talking about congenital insensitivity to pain with anhidrosis. You could call it CIPA or SIPA. And this basically means the insensitivity to pain. And we will first start with the neurological aspects.
So what is CIPA? So it's a rare autosomal recessive disorder. So do you know autosomal? It's a other chromosome. The chromosomes other than sex chromosomes. So we have 22 pairs of autosomal chromosomes. And recessive. So recessive means you need 2 of the defective genes to get the disease. So let's break up the name of CIPA. So first off, it's congenital, meaning you are born with it. Next is insensitivity to pain. So it's self-explanatory. So anhidrosis, it's inability to, if you guess what it is, but yeah, it's on your outcome. So let's go on to the physiology. So CIPA is caused by defective development of nociceptive neurons in the dorsal ganglion. So that's dorsal ganglion, and those are the sensory neurons. So in CIPA, you lack the pain fibers, which are specifically the A delta and C primary achron fibers. You also lack sympathetic postganglion neurons.
Alright, some background info from the lecture material. So these are all that's kind of involved in there. So we have the general receptors, which are distributed throughout the body, where afferent impulses are sent to the somatosensory cortex. Then you have the peripheral nervous system, which or peripheral nervous system organization, which has the somatic afferent fibers and the visceral afferent fibers. And the types of receptors involved is mainly the nociceptors. So this is the one that activate, or which has the activation that causes sensation of pain. And the three nerve endings are found in skin, joints, bones, and blood vessels. And it's sensitive to chemicals from tissue damage and extreme temperatures.
So defective development of nociceptive neurons is caused by mutation in the TRKA gene. So let's talk about some mutation.
Alright, so there's 2 mutations that are involved, which is the point mutation, which is a change in a single nucleotide. And then we have the frame shift mutation, which is caused by the insertion or deletion of a nucleotide.
So if you remember from protein synthesis, the genes encodes for the protein. So when this TRKA gene encodes for receptor tyrosine kinase for the ligand nerve growth factor. So this nerve growth factor stimulates the nerve cell repair, growth, development, and survival of neural cells. So some of the neurons that are dependent on NGF for growth and development are sympathetic neurons and nociceptive neurons. So when you have a mutation in the gene, you will encode for a defective tyrosine kinase. So example is defective NGF binding site. So you can see a picture here. So tyrosine kinase, that's from cell communication. Yeah. So So this is specific for TRKA. So if you can see, so this is the ligand, the third growth factor. This is the tyrosine kinase or TRKA, and the responses it produces are survival, growth, and differentiation. So when you during development, your cells undergo apoptosis, which is normal. That's when you have like split 5 fingers, not like web fingers. So for sympathetic neurons and alpha neurons, they need the NGF to tell them that not to have not to commit suicide, something like that. So if you have some mutation in the receptor, they won't get the signal to survive. So yeah, you'll just lose all your receptive neurons and sympathetic neurons. Okay. So
Okay, so this is also from the lecture, but I'll be explaining also what would happen if you didn't have like that sensitivity to pain. So right here we start off with the noxious stimulus, where it goes into the receptors, right, the nociceptor, and it travels through the afferent fiber and it responds, which releases substance P. And then from there, here's substance P being released, goes up the spinal cord, into reticular formation and the thalamus. Of course, in the reticular formation, you get the increased alertness and perception of pain. And from there, impulses would all reach the somatosensory cortex. But since we have a CIPA, so since those nociceptors are not there anymore, we can't send those signals up to the somatosensory cortex at all. So you wouldn't have any perception of pain or any alertness that you're receiving the pain at all.
So last part of the CIKA is adenomyosis. So if you remember from anatomy, the sweat glands are here. They're also innervated by sympathetic postganglionic neurons. So these neurons send signals to the sweat glands to tell them to secrete sweat. So this is the normal skins, and this is the skin person with TIPA. You don't see the neurons at all. So
And the sweat glands are only innervated by the sympathetic nervous system. And the sympathetic postganglionic neurons are cholinergic fibers, and they innervate the sweat glands.
Okay, so now we'll be talking about the symptoms, diagnosis, and treatment. So for symptoms, there's actually no set symptoms for people with, I'm going to call it SIPA, to make it easier, because they say it's CIP. This is because it's really rare, so when they've been, I would say, tested or checked upon, they show different manifestations. Like some people have mental retardation, while others don't. Some are hyperactive, and then others aren't. But of course, there's still some commonalities, like the basis of it, such as that pain insensitivity. There's also temperature insensitivity, and that's really major because if you're at extreme weather, you don't feel that at all. And one way your body copes with it is using the food bullet. It's high fever. And then the third one is there's no feel nerve-related sensation, such as the need to urinate. And that is pretty serious, but for people with SIPA, they actually can detect pressure inside their body, so that's how they know when they gotta go to the bathroom. And then, early age, you can get SIPA at a very young age. So for babies, when they're hungry, they cry, right? So if they have SIPA, they don't cry at all because they don't have hunger pains. And then they also have sudden high fever and seizures. And then self-mutilation. That's actually not just for infants, that's also common for adults. So that's, you can see on picture B, the baby ended up chewing his or her own thumb. And that also damaged the teeth too. And also fingernails, like chips off. Yeah, it's And then age 3 is usually the maximum age for babies if they have it. But if they've been carefully watched over, they could live up to 25. But there's no record yet of people that have SIPA living past the age of 25. So that's because if you get a big scratch, if there's a big wound, you could have an infection, and then there's no immediate response to it. So you can see some of the pictures there. And then also joint deformities, you could have a broken leg and not even realize it. And then scalp patches. This basically means that on your head, there's some areas where hair does not grow. So that's the scalp patches. And then diagnosis. So doctors know that you have SIPA because you have missing nerve supply. So again, just reminding, our nerve fibers allow us to communicate. The body and the brain communicate through our nerves. So if you experience pain, the pain messages do not get to the brain. So the diagnostic methods, we have 5. So biopsy is when a tissue sample is taken in your body and fibers are checked. If you have enough nerve fibers. And so if you don't have it, you have SIPA. Genetic DNA testing would be what Eduardo mentioned, the mutation gene. They check for that. And then for these two, amniotic fluid and chronic bullous is when blood is taken from the baby, but that's when it's still inside the mother's womb. And people don't usually do that because it risks miscarriage. And last one would be pre-implantation genetic diagnosis, and that is strictly for babies born out of in vitro fertilization.
All right, so as for the risk factors of CIPA, I couldn't find any commonalities or things that showed, only people that live in this area get it because it is such a rare disease, so there isn't too much, grouping of the disease. And obviously it's hereditary, so it's just the chance of whether or not you get those genes from your parents when you're born. So basically I just went into the risk factors for the patient themselves if they have the disease. They're kind of obvious. Self-mutilation is on Leah described, so often they have all the mouth sores because they cannot feel, them biting themselves, anything like that. Burns because they never know if they're on a hot stove or anything like that. Lots of bruises, bone fractures, because you can do basically whatever you want and not feel a single thing on you. The bad part of this is if things like that go unnoticed, just leads to further infection, further problems. So it's a lot of need to see it right then and take care of it at that moment. Heat stroke is really, really common because of the anhidrosis. So the patient themselves never knows if they're really, really hot and their body isn't going to respond if they are because they lack those sweat glands. So you're constantly having to check to see if they are over, the temperature that they should be. Heat stroke's more common. The cold, normally, a lot of people know they're okay, it's cold out, we probably need to put a jacket around them. And then gene, obviously, it can be inherited, so there's another risk in that sense that if you do have a child with it, they often talk to the parents about who has the genes and everything like that, and then the child themselves has to be cautious later in life that they don't pass that gene on to their child if they decide to give birth or anything. And then treatment. So sadly, there's no treatment for it yet. I've heard that they're looking for a cure, but nothing has been figured out yet. So everything's preventative. Obviously monitoring body temperature, like I said, to prevent the heat strokes. It's a lot of money going into orthopedic care, oral and dental care because of the whole bone fractures that come along very frequently, all the mouth sores and things like that. And eyes and skin is another thing that they have to be really, really cautious of. Dry eyes is incredibly common, as well as scratching of the retina is a thing they have a lot of problem with. Is during their sleep they'll go and like scratch their eyes and they have no idea that they do it. No, yeah, no hurt, nothing. They just, I mean, they wake up and then they're just like, oh my gosh, I can't let's go to that eye. And then behavior peril, just because they have to learn how to be cautious of what they do, especially with younger kids, because they have no idea. They just know, okay, I can jump right off of this slide and I'm not going to feel a thing. And genetic counseling, as I said, just talking to the parents, everyone else in the family to help them prevent passing this disease on if they decide to ever reproduce in their own life. And I think that's actually what we're going to wrap up with is the treatment. It seems like kind of a neat idea. A lot of people, when they first hear it, they're like, oh my gosh, it's like a superpower. You don't feel any pain, anything like that.